All right, we are back. So, today we're going to talk about weight loss. So, I know there's some of you out there, if you've ever been on a weight loss program, or if you ever been in the gym and then you tried diet, you tried exercise, you tried some medications, and it just didn't work. Well, today we're going to talk about a solution. We got something new. It's been FDA approved, and it really works, and it helps you lose weight. I have patients who've tried it, and they swear by it. All right, so what is semaglutide? Well, basically, it is a glucagon-type peptide that's secreted by your intestines, your small intestines. And then it acts on your pancreas, and basically it sends signals to your pancreas, and your pancreas is a hormone-type organ, and it produces insulin. So this peptide acts on your pancreas, causes your body to produce more insulin, and thereby lowering your blood sugars. So when your blood sugars are lower, what it does to your stomach is it slows down the emptying of your stomach. And in addition to that, it regulates your appetite a little closer. And so it sends signals to your brain and your body and your mind. Your desire to eat is diminished, and as a result of that, it causes you to lose weight. Now, this drug is approved by the FDA, and initially it was used for diabetics. And so after years of studying the drug, they found out that a lot of these people were losing a significant amount of weight, and now it's been approved by the FDA as a weight loss solution. So what are the benefits of semaglutide? Well, for one, it's proven and it's a healthy way of losing weight. It also regulates your glucose levels. It also helps control your appetite. And for those who have elevated hemoglobin A1C, it helps bring it down. Now, hemoglobin A1C is a level or a lab value that is used to monitor patients who have diabetics and to monitor whether they have better glycemic control or better control of their glucose levels. So it also decreases your risk of cardiovascular events, and those include non-fatal heart attacks or myocardial infarcts and strokes. So I know you're wondering now, let's say you're on this medication, you want to know when can you expect results. So I've had patients who've lost, weight within the first week, the first couple of weeks, but the studies show that a majority of the weight loss occurs 3 to 6 months. So you need to be on the medication for a period of time to actually see the benefits. And the reason why is because the medication has to be titrated up. So we usually start on a low dose, which is typically 0.25 milligrams, and it takes some time for your body to get acclimated and adjusted. And then typically every 4 weeks, the doses increase until we get to the maximum dose. Now, some patients may not need the maximum dose, and they can be placed on a lower dose and have the same efficacy. Now, there are some patients who may not see results at all, and for that cohort of patients, typically they have some other underlying conditions or problems, and I would say most of the time it has something to do with hormonal imbalance, whether that's high estrogen levels, low estrogen levels, your thyroid may not be functioning appropriately, or it may be due to sex hormones such as testosterone. So I know what you want to know. I know what you're thinking. Does it really work? Well, it really does. There's been a study over a 68-week period of time. The average is 15% of your initial body weight. So if you take a man and he weighs 230 pounds, he's lost about 35 pounds. Now that's great. That's really great. But you look at another cohort, 30% lost at least 20% of their initial body weight. I mean, that's crazy numbers. This program, this solution is doing mad crazy numbers. And then you take another cohort, 70% of the people who took this medication regularly, every week, they did their injection, they lost 10% of their body weight. So it definitely works. I mean, of course, with anything, everything, any type of weight loss program, You have to do your part. Like, you can take this medication, but if you're not making lifestyle changes or lifestyle modifications, your results probably won't last as long, or you may not get the result that you want. So what do you need to do? Of course, you need to exercise regularly. Now what does that mean? Okay, it just means like doing something active 3 times a week, whether it's like a light walk, a little bit of weightlifting, some running, jogging. You just need to exercise. Do something. Exercise is important, but you know it's the bigger key? It's the diet. So controlling your diet, watching what you eat, getting rid of the sodas, getting rid of the late night snacks, the pasta, the bread, the candy, the juices. You gotta cut back. You gotta cut back. You have to have some discipline, and maybe you need to eat smaller portions. You just have to find out what works with you, but for sure, you gotta cut back on the carbs. Now, just so we completely understand what I am saying, I'm saying 68 weeks. That's a little bit over a year. And so if you weigh 235 pounds and over 68 weeks and you're doing everything you need to do, average, now hear me again, this is average. Average is 15% of your initial weight. That's 35 pounds. Now I've had patients who've only been on a drug for a month and they've lost 8 pounds. So you can imagine, for each person is different, but we're trying to stay in this bell curve, So if we stay within that bell curve, I mean, that's 15%. But like I said earlier, 30% of the patients in this study lost over 20% of their total body weight. So if that means if you weigh 200 pounds, that's 40 pounds that you've lost. You've gone from 200 pounds to 160. That is amazing. Thank you again for watching this video about semaglutide. Again, I am Dr. Nicholas Jones with Nip and Tuck Plastic Surgery. And if you are interested in learning more about semaglutide, or you're in the Atlanta area, you can come in for a consultation, or you can go to our website, fill out a contact form. And one key that I would like to share with you that's very important is we do virtual consultations, and you do not have to be local to qualify and be treated in our weight loss program. Okay, so now that you're on this weight loss program and you've lost the weight that you wanted to, it might be time to go ahead and book that plastic surgery procedure. So if you're interested and you want to know what you need to do or what you need to know before having plastic surgery, watch this video right here.